If you've been suffering with a degenerative, herniated, or protruding disc in your low back, with or without sciatica, you may have tried numerous drugs, various forms of hands-on therapy, dangerous spinal injections, or possibly even surgery, only to discover that it didn't work. At Life in Motion Chiropractic and Wellness, we don't treat symptoms, nor do we treat conditions. We focus on correcting the cause of your spine-related disorder and create a treatment plan that will assist you in overcoming the underlying problem of your musculoskeletal pain. You need to know there is a non-surgical solution for spinal disc pain known as flexion distraction therapy that is safe, effective, and very affordable. Flexion distraction therapy is a chiropractic technique that utilizes a multifunction table that enables the chiropractor to combine decompression with other gentle, non-force spinal adjustment techniques. Flexion distraction is well suited for patients who need a lighter touch, such as those recovering from spinal surgery, currently undergoing rehabilitation, or those with osteoporosis or of an advanced age. Flexion distraction therapy is well researched and has been proven effective for reducing pressure on the spinal nerves from a disc bulge or herniation, increasing spinal motion within the disc and spinal joints, improving posture, a conservative option to surgery for herniated discs known as discectomy. In fact, a 2010 randomized clinical study found that spinal manipulative therapy is just as effective for treatment of most patients experiencing sciatica secondary to lumbar disc herniation, with 60% of sciatica patients able to avoid low back surgery by going to a chiropractor. The anatomy of a healthy spinal disc is 86% water and needs water, oxygen, and nutrients in order to survive. The spinal disc allows for both cushioning and motion and has two distinct regions: the annulus fibrosus, composed of tough protein fibers and cells, and the nucleus pulposus, which is gel-like and functions as a ball bearing. Above and below each disc is the vertebral body, which possesses a porous cartilaginous end plate through which disc nutrients pass because the disc has no direct blood supply. The cells of the disc obtain the nutrition required to maintain health and function through motion. An important aspect of disc nutrition and health is the mechanical aspects of the disc related to fluid mechanics. This pumping action maintains the nutrition and biomechanical function of the disc. If you injure the disc, the pump mechanism does not work properly and over time will cause bulging, herniated, and degenerative discs and possibly spinal stenosis. Disc injury results in structural disruption and loss of the hydrostatic capacity of the nucleus pulposus. When you decrease circulation in any type of tissue, whether it be animal, plant, or human, it becomes weak and begins to degenerate. The flexion distraction table gently stretches the spine and in effect becomes an extension of the chiropractor's hands, applying both decompression and movement of the spinal joints through a range of motions. The gentle pumping rhythm used creates negative pressure inside the disc, creating a vacuum that sucks the gelatinous fluid back in. As the nucleus pulposus reattains its central position, pressure is taken off the involved spinal nerve, reducing inflammation and subsequently relieving the associated back and/or leg pain related to vertebral disc displacement. The doctors at Life in Motion Chiropractic and Wellness have been using flexion distraction for several years to manage a variety of spine-related disorders and have assisted many patients in overcoming ongoing pain management, discomfort, temporary disability, and/or the need for spinal surgery. Conditions that may benefit from flexion distraction therapy are ankylosing spondylitis, lumbar disc injuries, degenerative disc disease, failed back surgery syndrome, general lower back stiffness associated with osteoarthritis or spinal stenosis, leg pain and sciatica, scoliosis, and ligamentous or muscular sprain strain. A series of these treatments combined with specific at-home exercises prescribed by our chiropractors will assist you in overcoming your pain and improve your self-efficacy.